patients have pain. Spinal cord injury, where you see somebody who is paralyzed and they can't walk. The fact is 70% of people who have complete spinal cord injury who are in a wheelchair, they have severe pain. That's their big problem, in fact. If they'll say, look, doc, if you can get rid of my pain, I don't care if I never walk again. You've got to do something about my pain. That's a neuropathic pain. Multiple sclerosis, which involves nerve damage, is associated with pain. And there's many examples. You might have heard, I'll show you a picture of post-herpetic neuralgia. Everyone knows what shingles is? All right? Shingles is the zoster virus. It gets in, and you might have an outbreak of vesicles on your skin, in the chest, or maybe in the face. In most people, in 80% of people, it'll clear up. It's unpleasant, it's painful, but it clears up. But in about 20% of people, it doesn't, and you get left with a nerve damage, because the virus destroys some nerves, induced horrible pain, post-herpetic, after the herpes lesion, neuralgia, meaning pain. Cancer pain, tumors invade tissue, they'll invade normal tissue, and you get inflammatory pain, and then they'll suddenly invade a nerve, they might go into the spinal cord, and you can have horrible neuropathic pain. Much more difficult to treat than the other type of pain. We'll talk, diabetic neuropathy may be the worst, maybe 30 million people. 40 million people have diabetes. Eventually you can end up with nerve damage, and you could end up with severe neuropathic pain. The other horrible example, unfortunately, is chemotherapy. Chemotherapy is where you're trying to kill tumor cells. Unfortunately, the same drugs that do that will destroy nerves and can produce neuropathies, neuropathic pain. So that the ways to generate chronic pain are abundant. There's no reason to have chronic pain. We need to do everything we can to understand it and get rid of it. Neuropathic pain is also associated with the fact that innocuous stimuli produce pain, and in the worst case, there's often ongoing burning pain. If a patient comes in and says, Doc, my arm is burning all the time, you immediately think there's some kind of nerve damage. It's almost a hallmark. Examples. This is a woman with post-herpetic neuralgia. It's in what we call the trigeminal nerve division. Literally, if I took a hair and just lightly touched the head, she would have paroxysms of pain. Air blowing in the room from an air conditioner could set it off. If it's on your chest, it's hard to wear clothes. So this is a severe type of pain, and unfortunately, it's all too common. This has many names. Reflex sympathetic dystrophy, you may have heard that term. Complex regional pain syndrome, the names keep changing. Here's an individual who had the slightest little nerve damage, the slightest problem. Wasn't even aware necessarily that there was some trauma. And look what happened to the arm. It started to swell, excess hair growth, the nails get glassy, and this arm is in excruciating burning pain, and light touch can send this person into paroxysms of pain with the slightest, mildest nerve injury. Very difficult to treat. Phantom limb pain is one of the more provocative ones. Everybody who loses a limb has a phantom. In the old days, they thought these people were nuts. They're not. The reason why you have a phantom, let's say I lost my arm, is that there's a representation of the arm still in your brain. As long as it's there, you're going to feel your hand. And people mostly, they can move it, they can control the phantom, they can move their fingers. It's pretty wild. In about 20% of people, the phantom is locked in a position. The nails, they'll say, are digging into my hand. Do something. Stop my pain. Phantom limb pain, you can get phantom teeth pain. Any part of the body, you can end up with phantom pain. Very difficult to treat. Another neuropathic pain. Fortunately, there are ways to treat it. They don't always work, but you never give up. And I'm going to try to cover as many of these as possible. Aspirin and what we call NSAIDs, and I'll explain that. Opiates. Morphine. How many people think morphine's a lousy drug? Oh, you love it. We'll get into that part too. All right, morphine. We'll talk about stimulation on the skin or stimulation in the brain. We'll talk about placebos, we'll talk about acupuncture, and we'll talk about hypnosis, all of which have a place in the treatment of pain. And I'll try to tell you what works, what doesn't work, how I think it works, and you can see if we can hopefully make everyone's lives a little better. So let's begin at the beginning. In the very old days, and people who give pain lectures like to go back to Descartes.